I will never forget that blood-curdling scream that pierces through the house in the middle of the night. Imagine the terror I experienced as a mother, sprinting to my 7-year-old's bedside to find her doubled over, clutching her knee in excruciating pain. I immediately go into mommy triage mode. Did she tear something in gymnastics? Break a bone? And the question I won't dare ask twice, can this be cancer? All I know, my baby Ava is suffering, and I do not know the reason why. Weeks later, she's diagnosed with an uncommon autoimmune disease called juvenile idiopathic arthritis, a condition that attacks the joints. In accordance with Arthritis Foundation publications, 300,000 children in the United States are afflicted with this chronic disease. To stabilize her health, it becomes my personal and uncompromising mission to establish a strong patient-physician relationship with her pediatric rheumatologist. Advocating as a team is the reason my now 12-year-old is an absolute pit bull on the soccer field. Between us, I actually love that part of her personality. But don't tell her, it's only allowed on the field. Ava's illness, unfortunately, was not the first serious diagnosis in our family. In 1974, at 27 years old, my father was told he had stage 4 non-Hodgkin's lymphoma. The prognosis? Less than 6 months to live. He was married to my mother less than 3 years, and they had my 2-year-old brother. Thankfully, he had a caring family physician who advocated for him, connecting him with the chief of oncology at an academic hospital. Fortunately, the oncologist considered my father a candidate for an aggressive clinical trial. He was treated with intensive experimental chemotherapy drugs. Sterility was one of the expected side effects. And yours truly should not even be here today. My father is alive today at almost 72 because he trusted and partnered with his doctors. Not only did he beat cancer once, but again in 2011. Almost 40 years later, history would repeat itself. Now it was my turn. It began with the proverbial dreaded phone call of biopsy results of my left ear. Tiffany, you have a stage 2 melanoma. As a 37-year-old mother of 3, I did not know what to do or where to turn. My dermatologist referred me to a highly skilled plastic surgeon. Point noted once again, just like with my father, having a strong and trusting relationship with your doctor can save your life. Within 1 week, I went from cancer diagnosis to curative surgery. Because my doctors and I partnered together, my ear is intact, and the tumor did not spread to my brain. When I tell people about my family's medical challenges, I'm often told we are lucky. And I agree. Think about it. My father and I both beat the second leading cause of death in the United States, cancer, behind heart disease. But until I started learning about healthcare, I did not realize what the third leading cause of death is. Medical errors. Depending on the study, 200 to 400,000 lives are lost annually due to medical errors. In 2014, the Journal of Patient Safety published, the silent killer takes 400,000 lives every year. This equates to 2 747s crashing and killing everyone on board every day of the year. This silent killer cannot be treated with medication or cured with surgery, but it can be stopped. As reported by Fast Company magazine in 2015, women make 80% of the family healthcare decisions. Women are responsible for selecting the doctors and choosing the hospitals. Our families depend on us to understand the challenges surrounding medical errors. Communication breakdowns, a lack of trust between patients and physicians, and faulty hospital processes can contribute to medical errors. As powerful women with grit, it is up to us to work on this problem and demand better for our families. Two important tools I use to navigate the healthcare system to keep my loved ones safe from harm are: one, an open and trusting relationship with your doctor, and two, acting as a powerful advocate. Find a doctor who listens to you like my father's oncologist. Find a doctor who is accessible through email, text, and cell phone, like my daughter's pediatric rheumatologist. Find a doctor who believes in shared decision-making, like my dermatologist and plastic surgeon. This is how we will tackle the third leading cause of death and decrease the occurrences of medical errors. 2 years ago, the unwelcome visitor returned. Cancer. Striking again, just over a year after my mother beat breast cancer. Only this time, it was not my skin. It was my thyroid. During my annual physical with my family medical doctor, I advocated for myself, shifting the focus to my thyroid because I had concerns. She told me my thyroid looked and felt slightly enlarged. Thankfully, my doctor was aggressive and sent me for an ultrasound. Days later, a biopsy for a suspicious nodule. I scheduled these tests promptly. After the biopsy, I received the call from my doctor. Hearing the devastating news brought me to my knees. I had beaten cancer once before, but this time, I am more petrified for my kids. Will I beat this? My trusted physician guided me to an amazing surgeon. Skillfully, he performed my thyroidectomy and put me back on the path to being cancer-free. How? My family doctor, my endocrinologist, and my surgeon partnered with me to restore my health. After surgery, my surgeon cleared me to go home. Just before discharge, I felt a subtle tingling sensation in my hands. I spoke up. The medical team assured me it was normal after surgery and was sent home without further instruction. This was the moment I should have been listened to. But I failed to speak up more forcefully and advocate for myself. Had I been more persistent, possibly readmission could have been prevented. The next day, the tingling spread from my face to my neck. This can be an expected complication from decreased calcium levels. I had to go back to the emergency room, then readmitted. When communication breaks down, it leaves the door open for medical errors. preventable hospital readmissions, and unintended harm. I am grateful for the care that I received while I was in the hospital, but I cannot overemphasize the importance of effective communication. I have learned a powerful phrase. I do not feel I am being listened to and need some clarity. Respectfully, I want you to use this phrase to gain the attention of any healthcare provider appearing rushed or distracted. Let me say it again. I do not feel I am being listened to and need some clarity. From my experiences about advocating, I have learned, do advocate for yourself. This is your health. Do bring concerns to your doctor, as I did with my thyroid. Do schedule tests and exams promptly with your physicians, as I did with my ultrasound and biopsy. This is how we will tackle the third leading cause of death, decrease the occurrences of medical errors, and save lives. My parents' survivorship, my beating cancer twice, and my daughter overcoming juvenile idiopathic arthritis has taught me so much about the resiliency of the human spirit. As powerful women, I'm asking you to join me in tackling the third leading cause of death with grit. Win the fight by establishing strong patient-physician relationships with your doctors, and become powerful advocates for your families. Remembering these two vital tools may just save your life one day, as they have saved mine twice. I know we are the ones to bring the momentum of change. So what are we waiting for? Thank you.